Hi, this is Dr. Giuseppe Marinacci of BioHealth Holistic Dentistry. Spinach, rhubarb, soy milk, tofu, raspberries, wheat bran, chards, sweet potatoes, nuts, beetroots, all healthy foods, right? But what do they have in common? They're very rich in oxalates. Oxalates are some special compounds present in plants that basically behave as anti-nutrients. Why? Because they can bind to minerals, in particular calcium, iron, and magnesium, which are essential to keep our teeth and our bones healthy and strong. So what does it mean? It means that if you are eating a lot of these oxalate-rich foods, the risk is that you can reduce the absorption of these important minerals, leading to consequences, to issues in your mouth. In particular, if you had a tooth extraction, and obviously there are no so many minerals available to regenerate the bone, the risk is that you can develop a so-called jawbone cavitation, which could lead to chronic illnesses in the long term. For example, if you had a dental implant, we need the bone around the implant to heal, to become a one piece with the implant. But if the minerals are not available, that bone maybe is not going to heal properly or completely. And you could be more prone to tooth decay as well. Okay, so that's why it's important to understand that the oxalates are a problem. Okay, for some patients, can be a big problem if they are very sensitive to oxalates. But generally speaking, we should avoid to eat so many oxalate-rich foods altogether, okay? Especially if we had a tooth extraction, especially if we have dental implants. Because again, the risk is that the bone could not heal properly or correctly or completely, okay? So it's not a good idea to have a smoothie with raw spinach, almond milk, beetroots, cacao, all oxalate-rich foods all together in one single drink, because that basically works as an oxalate bomb, okay? Can really deplete you of essential minerals for the bone regeneration and bone healing. In particular, with soy products, the problem can be even worse because 95% of all soy is genetically modified. Why is genetically modified? Because they want it to be resistant to glyphosate. Glyphosate is a weed killer, which basically is a powerful chelant, a powerful binder, and like oxalates, it can bind essential minerals for the bone healing, for the bone regeneration. So that's why soy milk, tofu, or any kind of soy products, if that soy is not organic, they can be a real big issue. Okay, so I see vegan patients and vegetarian patients who have, most of them have gum disease. They have problems with their bones. They have very soft pore density bones, and that can be part of the problem. Okay, oxalates and soy products can be part of that problem. So that's why my recommendation is to reduce the consumption of these oxalate-rich foods, or at least, try to not eat many oxalate-rich foods altogether, especially if you're going to have a bone surgery, or if you're going to have a dental extraction, a tooth extraction, if you're going to have a dental implant in the next weeks.